there are various applications that we're seeing at different touch points in the healthcare ecosystem. We've talked about ChatGPT, that's sort of front and center for everyone. Most companies are taking that concept and creating sort of their own bespoke versions where you are sort of having data privacy, patient protections, and the security that comes with it. And even at Parexel, we are thinking Parexel GPT to roll out in about a month. So there's that broader context. But for our purposes today, I'll be focusing on health economics outcomes research and market access. And not reading everything that we have on the slide today, but just to emphasize some of the core areas where we are seeing some of these applications. First point is around literature reviews, systematic literature reviews, where you're looking at using AI for abstract title screening on the front end, on the back end for quality checks. And when you're looking at RWD algorithm development, how we are bringing in big data to identify patients that have existing comorbidities, characterizing the patient journey, and going through that patient identification sort of process to optimize protocol study design on the front end. There are various applications and clinical feasibility as well, using AI machine learning to identify areas where you have high prevalence incidence of certain indications for site visibility and site identification on the front end to streamline the development process. Machine learning, big data, creating data lakes using deep learning to tease out some of the patient insights that you typically would not get in either RCT or RWD data. On the back end, when you're sort of thinking through that clinical development spectrum, from development through to access, reimbursement, there are also applications there where you can identify patient profiles for best responders that go into your value-based discussions as well. So these are some of the applications we are seeing across the spectrum. I'll circle back to predictive analytics broadly defined. But what that gives us, that last bucket, is shifting the paradigm from reactive healthcare to proactive healthcare, where you are thinking about identifying your patients, thinking about the early diagnosis and prevention, as opposed to waiting for diagnosis and cure. And we'll go through some of those applications for predictive analytics as we go forward.